Well, thank you. It's a pleasure to be here tonight. My name is Peter Nelson, and I'm the Director of Public Policy for Center of the American Experiment. It's a local state-based think tank that really focuses on state-level issues, trying to develop and promote solutions to the toughest problems facing our state and our nation. And with healthcare, I get to delve into federal issues as well, just because everything is all mixed up together across the states and across the federal government. So tonight I'm going to talk to you about the evolution of the healthcare marketplace under the Affordable Care Act, and I'm going to start with looking back and looking at where the trends have been moving over the past 10, 15 years. And after we look at that, I'm going to basically give you a sense of where I think things are moving. And after that, talk about some implications for your practices and for providers across the country. So this first slide demonstrates how employer-based coverage is declining. Employers are dropping coverage, and employers' non-elderly population with selected health insurance coverage has dropped from 68% to, I believe, 58% of employers right now. That's a 10 percentage point drop between 1999 and 2011. That's a big drop. Another thing this slide shows is that individual coverage has maintained pretty steady at about 7%. And so that's not where these people who are dropping employer coverage are going. They're going either into the uninsured market, they're becoming uninsured, or they're going to a government program. The following slide basically reconfirms the fact that employers are dropping coverage. The percent of private sector establishments offering health insurance are dropping substantially, going from 59% to about 50%. Now, what's important to look at right now is the fact that it's not all employers that are dropping coverage. It's actually the small employers. The large employers are still basically maintaining coverage. It's the small employers that are dropping coverage, and in particular, it's small employers with low-wage workers. Now, I know a lot of you are from Minnesota, so I thought I'd throw in a graph here to show what's going on in Minnesota between 1996 and 97 and 2010 and 11. And again, we see very similar dynamic here. It's the small employers that are dropping coverage, especially it's in fact the small employers with fewer than 25 employees. And I would guess that that's probably what's taking place across America right now. And again, large employers, they're maintaining coverage. Another dynamic that's happening right now is that more and more people are being covered by self-insured health plans. We've been moving from 46% in 1996 to, I can't see all the way over there, and I don't have that memorized, but it's higher than 46. The interesting thing, though, is that all of this growth is happening in really, really big companies. It's all happening in companies with 1,000 or more employees. Smaller, mid-sized employers, the self-insured rate in these employers is maintaining about steady. In fact, if there's anything happening, it's dropping. For Minnesota, we're seeing something very similar, rising numbers of self-insured compared to dropping numbers of fully insured. Another dynamic that we've been seeing take place is the rise of consumer-driven health plans, the rise of high-deductible health plans that are coupled with savings options, like a health savings account or a health reimbursement arrangement. That's happening right now across all employer levels, although I will note that it looks like here for smaller employers, that did drop in 2013. It looks substantial. We'll see if that's just an anomaly. But right now, the trend for most employers is that that's going up. And this graph right here it might be a little confusing. All you have to do is focus in the lower right-hand corner, and these are the people that are actually covered by high-deductible health plans. It's a growing portion right now. Over the past 8 years, we've seen substantial growth. So people who are using their own cash through a high-deductible health plan, that segment of the population is growing. It's steady growth. So summing things up, we're seeing small employers dropping coverage. We're seeing large employers maintaining coverage. And we're seeing a pretty stable individual coverage at about 7%. And the percentage of people that are self-insured is growing, but it's only in the big employers. And there's also very strong growth in the percent of firms offering high deductible health plans. So that's where we are today. Where are we going? There are, of course, a number of provisions within the Affordable Care Act that point us in a slightly, not even a slightly, in a different direction. It's pointing us in a different direction. These are all, I'm not going to go through this list. I'm not going to bore you with talking about all these items, but these are all different items that are changing the face of our health insurance marketplace. And this is what I see taking shape right now. I see a future where small employers that are already dropping coverage are going to drop coverage at a much higher rate. We're going to see a lot more employers dropping coverage. I think we're going to see sort of the inertia in the large group marketplace hold, and so we're not going to see that much changing in the large group marketplace. Maybe the most important thing that I'll be talking about tonight is I see strong growth in the individual insurance marketplace. It's been holding steady at about 7% of coverage. I think that's going to jump up substantially. And finally, while there had been some worries that the Affordable Care Act was going to basically ban high deductible health plans coupled with health savings accounts, those worries have basically gone away. The regulations weren't as bad as we thought they were going to be. Of course, they're bad, but they weren't as bad as we thought they were going to be. So there's still a future for these high deductible health plans. So I want to move on right now and talk about what I just pointed out there, which were the three biggest impacts. One big impact is the self-insurance movement, and the other big impact is the drop in coverage for small employers, and the other big impact is the growth in individual market health plans. So why are people moving to self-insure? People are first moving to self-insure because self-insurance basically allows you to exempt yourself from a lot of the onerous rules that are in the Affordable Care Act. And in particular, maybe the most important one, is it allows you to exempt yourself from offering the essential benefits package, the mandated essential benefits. And if you can exempt yourself from that, you get far more flexibility in the design of your health plan for your employees. Self-insured plans are also exempt from the new insurance tax, and that's also, of course, very important. That's just an immediate cost reduction. And guaranteed issue, these new guaranteed issue rules in the large group, in the small group marketplace between employers who are between 50 and 100 employers, they basically allow an employer to jump out of the fully insured market and go into a self-insured framework if they've got a healthier set of employees. And then once that healthy employee base changes and it becomes a sicker employee base, and they sort of lose their opportunity to be a self-insured company, they can jump right back into the fully insured marketplace. That's something new that came about through the Affordable Care Act, and so it basically allows them to freely move back and forth in and out of the market. And self-insured plans, of course, continue to be exempt from state mandates and from state taxes like they've always been exempt before. So what are the new incentives right now to to basically start dropping coverage? Of course, higher costs are the main driver of employers who want to drop coverage. We're going to see an incredible amount of cost pressure from the ACA due to all the new administrative burdens that are coming around. Of course, the ACA requires a bunch of richer benefits, and there's a whole bunch of new taxes. And what we just talked about right now, we talked about the incentives to self-insure. Well, many employer groups may be left with this sicker group of people. They'll be left with a sicker population of people in this pool. And if the group pool becomes too sick and too expensive, we're going to start seeing people drop out of that pool. And the only option then in that case would be to self-insure. And so that's yet another reason, yet another cost reason. And another reason we might see coming about is the fact that employers may receive a better tax subsidy, employees may receive a better tax subsidy in the insurance exchange. For these small employers that have low-wage workers, it may become an extreme disservice to offer coverage to their employees. And that's because if they offer coverage to their employees don't qualify for the tax credits in the insurance exchange. So we may see a lot of employers just drop coverage to make sure their employees have access to that. And another thing that's taking place right now is that employers just generally now know that their employees can get coverage in the private marketplace. Up until January 1st, 2014, most employers would know that some of their employees wouldn't have access to insurance. And that's because all but 6 states in the country allowed you to reject an individual to be insured. So that's what's taking place right now in the small group market. In the small group market and the group market in general, I see a lot of incentives to just drop coverage. And these are all the new taxes that are going to start raising costs in the system that will continue to be a new impulse for dropping coverage. And when you ask employers what they're looking at in the next 10 years, Towers Watson asked employers, and Towers Watson found that 26% of employers today basically question whether they're going to be offering health benefits in a decade. And that is compared to 73% in 2007. Employers are no longer confident they're going to be offering coverage. So what's driving growth? What's going to drive growth in the individual insurance marketplace? Well, going to be the biggest driver is the fact that the ACA prohibits medical underwriting. The new insurance regulations in the ACA require guaranteed issue in the insurance marketplace, and they require community rating, which means you can't rate based on your risk. And so that's going to drive a lot of people into the marketplace that would have otherwise been rejected. And there's also going to be maybe some better online sales tools. Now, these better online sales tools are related to the medical underwriting issue, because all of a sudden, you're going to be able to get immediate pricing for your health plan. This is maybe a good thing, but if I go online right now, I'm going to get an immediate price. Unlike my auto insurance, where I'm still going to have to wait 10 or 15 minutes. It's just a more seamless process, so people aren't going to drop out through the process. We, of course, have new tax credits that are going to heavily subsidize the individual insurance marketplace. There's the penalties for not signing up. And then there's going to be a lot of new consumers. All the employers that drop coverage, that is going to inject a whole bunch of new consumers into this marketplace. There's retirees that are retiring that are going to need new insurance. And as the baby boomers retire, they're not yet eligible for Medicare. They're going to be jumping into the individual insurance marketplace. And there also may be employers that start to switch to defined contribution to fund individual market health plans. And to me, right now, that's the most important possibility for the individual insurance marketplace. Where the Affordable Care Act should open up that opportunity. And that is one of my key priorities as a policy analyst at Center of the American Experiment. I am working to make sure that this happens. And the reason why this is a possibility is because of the community issued or guaranteed issue and community rating in the marketplace. Whatever the wisdom of that is, and I don't think it's wise at all. I don't agree with those regulations, but the one thing those regulations do is it opened up the possibility for an employer to fund an individual's health plan, and they would know that they were going to get covered. One of the biggest obstacles to employers setting up a defined contribution arrangement and just giving their employees cash had always been that they knew that some employees were going to get denied coverage in the marketplace. And that was a huge obstacle that could never be overcome. Now employers know that their employees are going to get covered. However, there's a big problem with this right now. The Obama administration has issued a regulation that they basically, in my opinion, have no legal authority to issue. They've issued a regulation basically banning defined contribution into the individual marketplace. It's still taking place, but it's going to take place in the shadows until this gets cleared up. So what are the implications of all of this for you as providers? I'm going to start with a glass half full scenario here, because I think for you, I mean, what I've laid out here is this is what the Affordable Care Act is doing to us. And despite what I think about it, despite how much I oppose the Affordable Care Act, it is starting some things happening that may have some positive elements that providers can key into and to promote the private pay practice, to promote cash pay, and to promote patients' freedom to choose how they want to receive their care. So the glass half full starts with the fact that with the development of more self-insurance and with more consumers going into the individual marketplace and buying their own health plan, they're taking greater control over the decision-making process. And they're taking greater control over their money and what they're doing with their health care dollars. The self-insured angle is a little tougher one to argue. The angle there is that we're going to see a lot of low-income employees dropping out of the employer marketplace. And when that happens, all of a sudden, you're going to see higher income employees. Higher income employees in the self-insured marketplace are going to have more control over how that marketplace looks. Of course, with individuals going into that marketplace, individuals will have total control. They'll have total control over their dollars, and they can then all of a sudden have a lot more power in that process versus the process right now where we have an employer intermediary and then we have an insurance intermediary. We have a fourth-party payment system right now in this system. We have a fourth-party payment system that includes the patient, the provider, the insurer, and the employer. And that system just doesn't work. It's never worked for us. If we can at least bring it down to 3 parties, we're moving in the right direction. So the other angle here that's happening is that there is a growing use of consumer-driven health plans. And this is right now creating stronger demand for price transparency in the system. The important thing that this is going to be able to possibly unleash is innovation in the insurance industry. If individuals all of a sudden are able to buy their own plan in the insurance marketplace, it's going to reshape what insurance looks like. And insurers are going to have to actually respond to individuals and what individuals want. Individuals are paying, and individuals will be able to ask for things. They'll be able to ask for design changes. And so you may see a lot of innovations in the insurance marketplace that starts to accommodate your practices, because your patients are going to have insurance, and they're going to want to continue working with you as a cash practice physician or whatever other processes you have in place that allow you to divorce yourself from the onerous contracting process. And so we may see a lot of innovations about how delivering policies that work better with you and with your arrangements. And I think there's going to be new opportunities for providers to influence insurance design, to coordinate better with their cash practices, and to reduce their administrative burdens. And I think of the example of a cash primary care practice where you charge a monthly fee, $50 fee for your patients. Right now, that doesn't work with most insurance products. If there's enough patients out there buying individual insurance and demanding an insurance policy where that's actually carved out of the insurance policy, you may find a huge new marketplace for patients who have an insurance policy that doesn't cover primary care because the insurance company knows that they're getting primary care through this alternative arrangement that you have set up. And there's other possibilities right now. We see other entrepreneurs stepping into the space. Consumers do need some help probably navigating this space, and consumers need some help working with you, and they're going to continue to need help working with the insurance companies. There's a company in town here called Gravy. It's run by the individual who started Definity Health, and Definity Health was one of the first HRA plans to come out, the first consumer-driven plan that we saw back, I believe, in 2001. And that plan is, the whole idea behind Gravy is to reach out to the individual and to offer that individual the services they need to connect with the right insurance. And I see that whole model morphing into how to connect the consumer with the right insurance, connecting the consumer with the right provider. So, and the increased competition is also going to help meet individual consumer and patient demand, and this offers, to me, the best opportunity to contain costs. And that leads us to my glass half empty take on what's going on. We all know that the Affordable Care Act basically doubled down on a very bad system. That's the general sense of what's happened. We basically doubled down on the fact that expanded Medicaid, so doubled down on our government programs, reliance on government programs. We have an employer mandate, and the employer mandate makes us makes us dependent again more and more on employers. That's the whole idea. So if this status quo continues, costs are going to continue to rise. And if costs continue to rise, we're going to see increased pressure from the government and from employers to do things to pressure all the insurers and the TPAs to expand all those strategies that I think everyone in this room loathes, the strategies that try to get us to pay for value, whatever value means to them. It's, of course, not whatever value means to the patient, but it's whatever value means to the government, whatever value means to the employer. We're going to continue moving in that direction. And if we do that, I see us moving to this public utility model where healthcare is basically electricity, and patients just don't have any sort of power in that situation. However, I want to end on a positive note because, to be honest, I really don't see us moving in that direction. This movement towards individual ownership is I think, going to create some compelling changes in our healthcare system. To me, it is our last best hope for a free market in healthcare. If individuals can freely choose insurance and can freely demand that insurance be designed in a way that suits them, that suits their interest in having a more direct relationship with their doctor, and allowing them to create a relationship with their doctor and where they can have a direct pay relationship, where they can have go to a doctor that doesn't have to be in some network. We might see designs that have reference pricing schemes in them where basically instead of having a network, you have a reference price. And if you're below that reference price, then you're good. If you're above that reference price, then the patient just pays extra. And these ideas are taking shape in the self-insured marketplace right now. And so I'll leave you with that positive note, and thank you very much for having me tonight.